Hi friends, thank you for tuning in to the Concussion Coach Podcast. I am Bethany Lewis, the Concussion Coach. I'm a neurological occupational therapist and certified life coach, and I specialize in guiding people through their concussion recovery journey. I am passionate about helping people understand their injury, speed up their recovery, and reclaim control over their life post-concussion. The purpose of this podcast is to help increase awareness of concussions and the impact they can have on a person's life, and to bring hope to people who have suffered a concussion and those who love them. I firmly believe that sharing stories and knowledge about concussions will bring important light and understanding to this misunderstood and often invisible injury. The information in this podcast is meant to bring that awareness and hope and is not meant as medical advice. The opinions shared are those of the interviewees and my own. If you are suffering with lingering concussion symptoms, I have created a concussion coaching program specifically for you. I will be your mentor to guide you through your recovery journey, offering help with understanding and managing your symptoms, setting achievable goals, and learning how to manage your own thoughts and nervous system in order to get control over your life again. If this program sounds like something that would help you or someone you love, sign up for a free consultation. In the consultation, you'll get valuable information and resources and gain hope for your future. Sign up for your free consultation at the link in the show notes or at my website, www.theconcussioncoach.com. Hi friends, welcome back to the Concussion Coach Podcast. I am so excited today to be bringing back Dr. Devin Duval and my dear friend Kaylee Blair for today's episode. We had a great conversation together back in 2023, episode 28, that I will link in the show notes. Kaylee and I are excited to continue our conversation with Dr. Duval. So Dr. Devin Duval obtained his bachelor's from Brigham Young University Provo in exercise science. He received his Doctor of Optometry degree from Southern College of Optometry in Memphis, Tennessee. After graduation, he completed a residency in pediatrics, vision therapy, and vision rehabilitation, making him one of 3 optometrists in Utah to gain this type of advanced training. He also completed his board certification in vision development and vision therapy, making him a fellow from the College of Optometrists in Vision Development, FCOVD. He's also a member of NORA, Neuro-Optometric Rehabilitation Association, and an associate professor at Rocky Mountain University. So thank you so much for being with us again, Dr. Duval. We're so excited.
So excited to be back. It was great the first time and great to be back again.
Yay,
Working with the schedule.
Good conversation. Yes, thank you for being flexible with us. So we have a few topics that we thought would lead to some really good conversation and helpful tips for our listeners. So the first thing that when I first heard about this, I was so fascinated by it, and I'm really excited to have you teach me more about it, is Syntonics. So I will just throw that word out there and let you explain everything about it to us. And I'm sure there will be a lot of questions that come up, but we'll just ask you those as you go. So
Yes.
What is Syntonics?
Sure. So Syntonics is just applying selective light frequencies to the eyes. So there's lots of things out there about red light therapies and other therapies, but Syntonics is specifically light frequencies in eyes and helping fix different vision conditions through that.
Okay. And how does it work? Like, what does people use it for?
Yep. So we use it for a lot of different things. So started initially with just our concussion patients, but we also use it for our lazy eye patients as well. We use it for our stroke patients and getting their visual fields back. We use it for some of our patients with sleep. One patient actually used it to help get rid of their seizures as well, which was not something I was planning on helping with, but they really wanted to try. So it's the whole point of Syntonics is to help with the autonomic nervous system and homeostasis, right? So anytime we have something that disrupts those imbalances, we want to encourage it to be back in balance. And so Syntonic uses light filters to work with that. We know we can use light for things like vitamin D. We know that light helps with our sleep and wake cycle, melatonin production. We'll use light for people who are depressed in places like Alaska when we need these sad lights to help get them. And so we've got some applications that we've already become very familiar with. And then there's a lot of other applications that we can use this for as well that we're getting more and more understanding on. So my concussion patients especially are the ones that we like to use it with because their autonomic nervous system is very much stuck in that fight or flight sympathetic. And so we want to help them both into sympathetic and into parasympathetic. They need to be able to transition back and forth. And so the way we do it is we'll end up testing them for filters that they need, checking their visual field, and they take home a pair of colored glasses to use for about 20 minutes a day.
And
And
do they just like wear it around the house, or are they supposed to look at a light with it, or what do they do?
yeah, they need a full spectrum light source. And so the best way to do that is just go outside, take a look at the sky, not the sun, but the sky, and use these filtered glasses. And we'll often send them home in pairs. So they'll wear one pair for 10 minutes, and then they'll wear the next pair for 10 minutes. And they just do that once a day at a minimum. I've got patients who have done it more than that, but once or twice a day is about all we really need for most patients. And then we recheck about every 2 weeks to see how they're doing. And within a month to 2 months, we're usually done with the Syntonics part of treatment.
So is it usually just like, you said you send them with usually 2 pairs?
Yeah.
Like what color, like is it always the same colors, or is it like depending on the person? How do you know what color to give them?
Yep. So there's a couple different ways we can figure out what colors they need. There's probably 10 different glasses that I use most often here in the clinic. And then there are way more that we could use. We're basing the glasses on a couple of things. One is their field. And when they come in, there's different ways to do visual fields. When you go see an eye doctor, the most common way to get your field checked is you click a little button. There's little flickering and flashing lights moving around. And that's a really good test for things like glaucoma and macularization and other pathological type conditions, but is not as good as what we call a functional visual field. How well do I actually use my visual field that I have? And so we'll use different colors, green, red, blue, to check their different cones that are in their eyes, and different colors that are most sensitive in their eyes, and also motion with white. And so we'll check and find out how big their fields are and see what kind of damage has been done from either their stroke or their concussion. We'll see odd things pop up with double vision as well. And then that'll be one tool we use to check and figure out what glasses they need. We'll also match their symptoms with the glasses. So if they have a recent concussion, we'll give them certain glasses. There's a blue one and a green one specifically that we'll use. And all of the glasses have really crazy Greek names to them, like upsilon omega and mu upsilon, or alpha delta and mu delta. And so the colors and the names, there are specific colors that we're using. And so they have been given special Greek names just to make it more complicated, more fun, right? But that makes it more standard across the board as we're doing this nationally. So it's not just red, because red has a spectrum that we'll use, like FL41 we'll use for post-concussion patients and our migraines. But we'll use a different red to help actually modulate their autonomic nervous system to help improve that. Last, we'll also have them try on the glasses and make sure that they are comfortable and that they're ready for those glasses, because just because I know what they might need doesn't mean that they're quite ready for it. And so we'll try the glasses on as well.
How would you know if they were not ready for, like, what
instant headache.
Oh, okay.
So yeah, they'll try it on. Instant headache, uncomfortable. I've had people, we'll have them wear them about 2 or 3 minutes just to kind of get an initial reaction from them. I've had people cry and feel depressed, sad, and we're like, okay, that's a little much for you. Let's maybe pull back a little bit, because the one pair of glasses in each set is usually a sympathetic innervator, so it's pushing on that fight or flight. And then the second pair is a parasympathetic, rest, digest, that can also be sleep or depression, if it's too much for them as well. And so I've got patients who aren't ready to like pop out of sympathetic, and if I try and give them the parasympathetic pair that they need, it's just too much. And so we have to actually match them, give them sympathetic innervators, help kind of support where they're at, then gently guide them out to a more neutral position. So
that is so fascinating. I'm like
right?
trying to process all of this. So I still have so many questions. So if I'm curious, if it's too much, like let's say that you decide, like you do your testing, you figure that a blue would be good for them.
Yeah.
It's too much for them. Would you, sorry, would you give them like a different shade of blue to work up towards that one, or would you start with a totally different color?
Probably a different color. And so there's a whole spectrum of lenses that I can pick from based off of how far we want to go. So I can go all the way to a very intense sympathetic innervator and then slide all the way to a very intense parasympathetic. So sometimes we'll just do a autonomic nervous system balancer and try not to push on either side, but just like, hey, can we just help you balance a little bit? And we'll start with like 2 minutes a day rather than 10 to 20 minutes a day, which is what they usually want. But giving them a little bit, because just like if I was prescribing a medication, sometimes I can't give the full dose right at first. We have to kind of space it out. So we may have to give them a little bit at the beginning and then gradually up the dose. So there's one that we use. It's called Alpha Epsilon. It's kind of a nice, softer red color. And it's a happier lens for most people because it's just calming things down, very relaxing. And we'll start with that and then 2 weeks later, see if we're ready to maybe add on like an Epsilon Omega that's better for some of our light sensitive, recently concussed patients that need some of that. And so we'll work up to the lenses that need.
Okay. Sorry, I have more questions. I know, Kaylee, if you have questions, you're welcome to ask them, but not until I'm finished. I'm just kidding. You can ask them, but I'm like, I have so many. Okay, so with I'm curious about the visual field thing. Like how does color help you know what they're like? Is it how much of the color they can see, like how far into their periphery they can see it, or
Sure. So without putting it on the screen, let me just kind of explain what I would normally see. So you're going to see a blind spot because everyone has a blind spot in their eye. It's where the optic nerve goes into the eyeball. There are no rods or cones on that spot. So we'll plot their blind spot, make sure it's appropriately sized. It shouldn't be large. Sometimes the blind spot will get bigger. Then our smallest fields, yes.
Sorry, is this you looking into their eye or them telling you what they're seeing when they're looking through?
Yeah, so the way it works is when we're charting the field, they have a center target that they're going to look at. And so we'll put in a green wand with a little green chip on the end of it, right? And so then we bring in another green wand and tell them, when you can see the green in the center, the same as you see the green on the side, let us know.
Oh, okay.
And so then we're going to match because they're going to be able to see this little wand coming in with the green chip on the end way before it actually looked green.
Got it.
So they're like, I can see it, I can see it, I can see it now. Mm-hmm. And so then we'll plot that spot, and then we'll plot a bunch of other spots around until we get a full field.
Okay. Oh, that's so okay.
And so we'll do the same thing with green as we do with the red, which is supposed to be a little bit bigger. Mm-hmm. And then blue is supposed to be even bigger than that. And then our biggest field will be everything, including motion. So tell me when you very first see things enter your vision at all as you're looking into this little visual field instrument. Got it. So they should see it pretty quick. Blue should almost match their full field. Blue is our most sensitive field, which is why things look bluish in the dark, right? It's kind of like a blue-black color. Yeah. And then red and green are other ones, but they're way more sensitive, which is why things like gas stations will use red and green signs in the dark because they're actually pretty accosting at night. They're very bright, right? And so they'll key into those specific frequencies as well so that they can blast you with whatever they're trying to advertise.
Interesting.
So we'll watch their fields, and the red and the green fields are the two smaller ones, but are also most sensitive to concussions and recent trauma. And they will collapse under stress. So people will often have tunnel vision when they are under stress. If you or I go driving in the snow here, that's going to hit Utah in the next couple of months, right? If we go hit a snowstorm, we're all going to get stressed, and our visual field's going to shrink as we're stressed. And we'll miss things that we wouldn't have normally missed because we are so focused on whatever's in the road ahead of us. But then after you and I get out of the car, our visual field opens back up. We're not stressed anymore. Things are good. Unfortunately, with people who have had trauma, stress, or traumatic brain injuries, acquired brain injuries, like we can have their field collapse and then stay. And they feel like they're always looking through a little tunnel. And you check their visual field with the traditional click the button method, and they have a full visual field, they're just not using it appropriately. So all of that visual field that is outside of what they're actually processing in the central area is interfering with vision rather than helping their vision. They feel visually overwhelmed. They feel like they can't process things anymore, and they're constantly triggered by things all the time, and they don't know why. And so we check this field, and when we can see that collapse, then we know why. We can show the patient why their field is off. So that peripheral vision that becomes super important for helping us stay alive and be aware of threats in our environment is constantly getting triggered because it doesn't know how to process.
Okay. And so doing the glasses, the lights, will help to increase that visual field?
Yep, it'll help reestablish their field filter and process appropriately. Because we want a full visual field. We want a big visual field, but we also want our peripheral vision to filter out things that are not important. So that as we're looking at things, if things are happening around us, we can just ignore them. We don't constantly get triggered by everything that's moving in our environment.
Right. We don't think that everything is a threat. So our body is responding that way.
Because it does trigger that sympathetic response, that fight or flight. And so when they go to these places like Costco and get overwhelmed by just being there, they don't understand why it's so triggering for them. So that field is part of it. And so we're wanting to open up that field to help them process better, help dampen down their sympathetic nervous system so that they're not quite so triggered and constantly stuck, and help them balance their visual response to what they're seeing.
Oh, that's so fascinating. And so I would love again, still have more questions, but I would love for you to share if somebody's listening to this and they're like, oh, yes, that's me. I feel like I can't see, or maybe they don't even realize that their peripheral vision is, they're having the tunnel vision. Are there things that you would suggest that they try or things that they can do to try to help expand that peripheral vision and help that visual field? Things that they can.
Yeah, so ways that they can start expanding that. So going on walks is a good place to start. So nice open fields, lots of open space, and then pay attention to how much you are seeing as you're walking. Right? As I'm looking straight ahead, what can I see out here? Am I paying attention to the trees on the side or the cars over on the other side? Or am I only trying to limit myself to what I'm seeing straight ahead? Then you can move to yourself to like more crowded pathways where you're walking through a nice trail, but there's a lot more passing peripherally. And then you can take that in. Those kinds of things can be really easy starts. Things like cars are tough places because you're moving really quickly and there's a lot going on. And there's a lot more that feels threatening in a car. But walking and running and biking are a lot easier things for you to do to add some motion and add some periphery in a safer environment.
Okay, I love that. Thank you. And I'm curious too about you mentioned light sensitivity. Is the Syntonics something that can help with that, or are there other? Yeah, let's talk about light sensitivity for a second.
Yeah, absolutely. So yeah, light sensitivity is one of the best things that I like to do Syntonics with. So I didn't start doing Syntonics until 2019. So 2018, I had heard about Syntonics and I was like, this is too wild for me to even try. Thank you, but no thank you. Right? I'm going to do things that actually work. And then I was 2019, I went to a 2-day conference prior to the COVD now OVDRA meeting, since they've rebranded. I went to a 2-day class on lenses, tints, prisms, traumatic brain injuries, and also Syntonics, kind of like a 2-hour side note as part of it. And Dr. Fox, who taught the lecture that day, was giving me just a couple quick things to try. And so I said, you know what, it's worth a try. So I went home, bought a couple of things, put them in the clinic, and had one patient. She was super light sensitive and had been with us for a while. And so I asked her if she wanted to be my guinea pig and see how things went, because she came in with a hat and sunglasses into the clinic, very light sensitive. And she just was not responding the way our other patients did. And like, let's give it a try. So I sent her home with the Syntonic kit at that point to try out, and told her to come back. And 5 weeks later, no hat, no sunglasses, just sunglasses outside like a normal person, right? So way better, right? And I was like, apparently we did something. So yeah, definitely started using it more and more for my concussion patients, and it's been super helpful. Not everyone gets the flash bang like this patient did in this case, which was great, especially for my guinea pig patients.
Right, right.
It does get significantly better with the phototherapy. And I do think part of it was because she'd been doing vision therapy for so long, adding Syntonics in was super helpful for her. So now when we do it with my patients, it's the very first thing we do because it is so fast, so easy that really within a month or so, we can get a lot of progress without having to do this big, huge 4 to 6 month, investment vision therapy. Like we have patients who are all across the bell curve. Some patients respond minimally, most are normal and get a good response. And then we have those good handful of patients where they do it and all of their symptoms are completely gone within a month.
That's
and I was
great.
like, it is, it's crazy. I'm like, are you sure? You're not like, we had one guy referred for a nerve palsy. And so he was seeing double up and down. And they had told him, yeah, there's nothing we can do. There's no surgery. It's been hanging out for a couple months. It's probably going to stay forever. And I was like, oh, let's do this. So I gave him the glasses. He was a farmer from down South Utah County. So he was, pretty old school, and gave him the glasses. He went home with them for a couple weeks, came back. Half of his double vision was gone. It was like locking in. It was double vision sometimes, but not all the time. And I was like, great, I'm not going to change anything. Let's do it again. So now with a couple more weeks, he came back and his double vision was all gone. And then like, maybe I just made you suppress an eye. Maybe it's just off and on vacation. So I went on a bunch more tests. And I'm like, no, they're together. Congratulations. I'm going to take a break on the glasses. I'll see you in a month and see how things are going. He was still stable. He was done. We had 6 months of vision therapy planned for him. It was all done, right? Yeah. So we definitely started using it with my strabismus and amblyopia patients as well.
Really?
One of my first patients was a BYU law student, and we had been working with him for, I think, 6 to 8 months already, doing all the normal vision therapy stuff. And he was looking at all the Syntonics. He's like, is that for me? I was like, no, that's really not for you. He said, why not? I was like, well, I guess you can. You could do this. It's supposed to help people with lazy eyes, but I just haven't done it yet. And he's like, cool, I'm your guinea pig. So we sent him home with a different set of glasses to use. And he used those. And he went home for spring break in Florida and came back. And we were on the verge of getting maybe some depth perception. Like when we do our little depth perception book, it felt like maybe he was going to start getting some stuff eventually, but he just couldn't quite get it. Came back, and on our little 3D book, he was able to do all of the hidden pictures that popped out. And then there's bubbles, and he got 8 out of 10 of the bubbles. And I was like, cool, because he had an esotropia, eyes in, a vertical tropia, one eye is higher than the other, and what's called a cyclotropia, where one eye would rotate in his head as well.
Oh my goodness.
And so we did the glasses with him, and all of a sudden he got depth perception. And I was like, great, you've done this for a month. Wonderful. Let's take a break. I gave him a break for like 2 weeks, checked his depth perception again, and he was regressing. He was like, instead of 80%, he was like 50% and struggling with some of the hidden pictures. And so I gave him the glasses back again, popped right back up again to, 80% depth perception, and no double vision. And I was like, cool. I don't know what we just did, but it worked. And so
crazy.
Yeah, so we've done lots of, so we started adding that in for all of my lazy eye patients as well, because it's one of the best tools For my vertical strabismus patients, my esotropes who are eyes in, we want their eyes to relax a little bit.
How? Like, do you know why? Like,
Yeah,
I don't understand. Why is light frequencies changing the actual like
yeah.
position of the eye?
So we're also targeting different neuro pathways as we do this as well. So more than just a balance, there is a balance to the extraocular muscles as well. So they have a tonic position of where they sit in your eye socket, right? Is that a little in? Is it a little bit out or up? You have a number of muscles that are all working to keep things aligned. And the muscles have primary, secondary, tertiary functions of up and down, left and right, and some of them, a lot of them have rotational components as well.
Mhm.
And when everything works perfectly, they sit straight in our heads.
Yes.
But most of us actually have a little bit of in or a little bit of out, and that's all very normal. So what we want is we want to encourage a more straight state for these people. And so by targeting different pathways, different muscles, we can get one to be a little bit more engaged, one to be a little bit more relaxed. That's going to rotate the eye a little bit more straight. So bring the eyes a little bit more vertically aligned, horizontally aligned, or rotationally if we need it. But yeah, just if we can get their resting state to be better, then the eyes will click in and then they lock and then we're happy.
And the different light frequencies can affect the nerves that are innervating those muscles to adjust that.
Yep. The nerve pathways that go to those muscles and help them get a better state. Yes.
That is so
Yeah,
cool. It's so
I know
crazy.
it's wild. I get you. Like,
But it
you
works.
know,
You've seen it. You're-
still as I talk to people, I'm like, look, just do it for me. This is
it
crazy
feels
stuff.
magical.
It feels magical, but it's super helpful. You know, I get patients, and when they give me the weird eye when I'm telling them like, look, I get it. Just do it for me. I like things that work. This is going to work for you. And then I get people who come back all the time who are like, told me this was going to work, and I didn't believe you, but I did it. My headaches are way better than they were before, and this has been like the only thing that's helped them. Like we've got one Syntonic glass that's more like a headache reliever, and they're like, yeah, Tylenol doesn't touch this, ibuprofen doesn't touch this. As soon as I started wearing these glasses, the headache started going down, and so I use them 10-20 minutes a day when I start getting a headache. And by the way, you never get these glasses back. I'm keeping them forever because like they're super helpful. And you got to match the right glasses to the right people, but there are definitely trends and glasses that I know are going to be more helpful for certain conditions. So we'll give them and it works and super helpful. Most of my patients use the glasses, use them for a month or two, and then they give them back. And then once in a while, we have patients that just want to keep them forever. That's fine too.
That's
So
so if somebody, I love this, and I love that it can be so effective for light sensitivity headaches, for apparently even like lazy eye, strabismus, all those things. Like that's so
yep.
cool. What would you recommend to people who are listening to this who are like, oh my gosh, I want to try this? How can they experience it, or do they need to go see a vision therapist?
Yeah, you can find things online, but like a prescription for drugs, it's going to be best if you can find the right prescription. So the College of Syntonics has a place where you can go online and find doctors that practice Syntonics. If you go online to FCOVD.org, you can find someone that does vision therapy. And a lot of those doctors that do vision therapy and are board certified to do vision therapy also do Syntonics, but not everyone.
Okay.
So
Question
like here in Utah, I think there are 3 of us in Utah that do Syntonics the way I just described that. And so we had at our recent meeting down in St. George where Syntonics was a topic of discussion and a lecture on it. But a lot of people are starting to dabble in it because they realize that there's some benefit to it. But at this point, finding someone who's gone to some of the trainings and the conferences, I went down to a training in a 4-day conference in Phoenix just last year, so I could get more training because there's still more things that I'm figuring out about this and how it works and trying to make it better and more effective for my patients. But yeah, the College of Syntonics would be one resource to go on to find a doctor that does this, and then COVD.org would be the other one.
Okay, thank you. I'll try to link both of those in the show notes as well, because that's very, very cool. Thank you. Kaylee, do you have any other follow-up questions or comments? I know you've been a vision therapist. Do you have any stories you want to share or things that you want to talk about with Syntonics?
Well, I was just curious if, Dr. Duval, if you could explain visual snow a little bit. And I was curious if you have found some benefits from Syntonics for visual snow.
Yes.
And then I had another question after that. But...
Yeah. So visual snow. So for those people who have never had that, that's great that they never have. But visual snow, it's like when you get the TV, the old TVs that had little rabbit ears on them, and they're just not quite in tune, and you're getting static essentially in your vision, which is essentially just an overactive response that your vision is making up things that are just not there, and it's trying to provide information, and it's just too much. And so we have to usually calm it down. And so visual snow, definitely more often with our patients who've had a traumatic brain injury, acquired brain injury. The two best things we found for visual snow have been vision therapy and Syntonics. Those are the two best things. And there's a protocol that we'll run people through to help calm those down. And so I feel like at this point, we're a little bit better than 50% success rate on those patients. I wish it was better, but those patients respond, they respond beautifully. And the visual snow just goes away when we do the vision therapy and Syntonic stuff. I guess the visual snow syndrome also comes with some weird things. Palinopsia is one of those things. It's kind of like cartoon vision, where they see things with an actor image trailing behind it as well. We've had a bunch of patients we've worked with in the last year with that after image palinopsia that we've fixed. At this point, all of our palinopsia patients have been able to fix that part of the puzzle. Just with a combination of filters. One girl that we just fixed, we gave her the filters. We said, yeah, you get to keep these because hers kept trying to creep back. And so by having the filters at home, she was able to, if she felt it start to creep up, she'd just use glasses, calm back down, move on with life.
And the filters are just specific colors that you put
Yep.
on the. Okay.
Yep, they're specific color filter glasses that we either rent or sell to people to take home and use. And we found a specific color combination for her that was helpful in calming things down. So interesting, because she had done vision therapy somewhere else, and it just really triggered her symptoms. Just super triggered, super overwhelmed. She was very nervous to do anything.
I was gonna say, she is brave to come and try again.
Yeah, she was like, I heard you could fix me. I was like, I could definitely fix this, but it's going to be, one step at a time. So we started with our most gentle lenses, a couple minutes a day, working up until she felt like she was comfortable enough to do the lenses and the therapy. And then we worked with her in vision therapy as well and got her all fixed up. So yeah, the visual snow is one of those tougher ones out there that has been when we're trying to figure out, and there are things that we can do with the visual snow syndrome, VSS, to help calm that down so they don't have quite so much visual snow. And it's more successful than not. Like I said, we're about 60-ish% for success rate, and still hoping to figure out how to fix out those last 40%.
Beautiful. So can you explain? I found when I try to tell people like, hey, go do Syntonics, go find that. And I often am like, go see Dr. Duval. But they often are like, well, I have colored glasses. And I'm like, okay, they're different.
Yeah.
So can you help explain that, Ian?
Sure, absolutely. Yeah, thanks, Kelly. I'd have to sit down and count how many different colored glasses I have here at the clinic. And some of them are symptom relief glasses that we use to help manage symptoms. And so like our FL41s and our aqua glasses, and I have an entire box of a whole rainbow of glasses to help with symptom management, the Band-Aid part of this. And so we can definitely use those glasses to help manage symptoms, but in the end, if I can fix you, I'd rather fix you. And so there are glasses that I would never give people as a symptom management, but are going to be a treatment pair of glasses. So I want to find the correct frequency and color pair to help move things forward so that I can do this for a couple of months with the glasses and then you don't have to use them anymore. And so, yeah, there's lots of glasses you can buy online for the migraines and for driving at night and those kind of fun things. But if we can fix it, we really should. So I've got, red and green glasses that we can use for 3D activities. I've got red and blue glasses for the same thing. I've got red-green glasses that we can use to help reset some of the visual stuff that we're working through. And then there's lots of other common color combinations. Greens, teals, dark greens, light greens. They all have fun names to them. Dark blues, light blues, a ruby colored red, an amber colored red, and all these different colors that have different purposes to help fix the imbalances that you've got in your system so that we get you back to a more comfortable state. So the goal here is to come in, let's see if we can get an eval and see if we can find some glasses to help moving things forward so that you're not so stuck.
That's
So
awesome.
essentially the colored glasses, like a lot of people love to go on and find rose colored glasses.
Yes.
And
Yep.
so that's like a Band-Aid. That's like, let's relieve it for a minute. And then the Syntonics is, let's go fix it.
Yes, very much. Like the rose-colored FF41s are the Band-Aid. And my goal is always going to be, first and foremost, can I fix this so that you can be as close to normal as possible again?
Yeah. Yeah. Great.
Excellent. Is there something I remember hearing that green light can be calming for people or like help with sleep or headaches and things like
Yes.
that.
Yeah, so the green ones tend to be more on that parasympathetic side. And so those are more calming, relaxing, relieving. So the one that we use most for our headache management is going to be it's called a Neuro-Optometric. It's like a teal green. It's very nice. And you do it
Very
right
relaxing.
before, yeah. If you do it right before bed, it's nice and sleepy and help get you into that state where you can get to sleep better, stay asleep better, those kind of things. So yeah, we'll definitely use those. It's nice that you use the glasses during the day as a treatment pair. But if we want to use them right before bed, we usually have them buy a full spectrum light bulb and just use the full spectrum light bulb right before bed, get them nice and sleepy so that they can go straight to sleep.
That's awesome.
Yeah, it can be really nice that way.
Awesome. I feel like while we're still on the topic, I know we have a whole other topic to talk to you about, and I don't know if we're gonna have time, so we might have to bring you back again if you're
Sounds
okay
great.
with. Because we like these conversations, but I think that we should probably address just really quickly put it out there because I know people are going to be curious about it. Blue light glasses and like how to handle screen like issues.
Yes.
What recommendation would you have for people dealing with that?
So blue light glasses, it's a mixed bag. So for my patients who are just normal patients and want blue light glasses, I'll typically tell them if you've got macular degeneration that runs in the family, or you're on the computer for a significant portion of the day, then blue light glasses are a good idea. It may help with strain. It may help cut down your risk for disease later in life with macular degeneration. But still waiting on some of the studies to be better on that. For my patients who have had concussion, blue light glasses tend to be very helpful because they tend to knock down some of those higher frequency wavelengths that are more annoying and more straining for patients. And so for most of my concussion patients, I'm going to recommend a blue light filter. And so having that for all screens would be helpful. But then, there are definitely better blue light filters and then worse ones. So you may get a good one online at Amazon. You may not. It just depends on what you got, right? Mm-hmm. So yeah, blue light filters generally recommended for all my concussion patients because they are more helpful than not.
Okay. Is there a specific brand or something that you do recommend, or like how can people know if it's a good one or not?
Yeah.
Or just
if
try
you use it and it's helpful for you,
okay.
You found a good one. If not, then you may want to come find an optometrist who can make sure they get you a good quality one.
Okay.
And then if you try it at that point and it's not helpful, then you know that you just don't have much problems. the same way to the blue light. But for most of my concussion patients, they respond really well to the blue light filter.
Okay. So I'm going to ask a personal question then. I find that and I have not had a concussion that I'm aware of. I find that if I've been on the screen for a long time, especially if it's like, well, the computer and also my phone, that I tend to, sometimes I'll feel like I'm more light sensitive and I'll get headaches from doing that. So with blue light glasses, is that what you would recommend for that? Or is there something else that I should be thinking
Yeah,
about?
so blue light glasses are a great place to start. It's not necessarily just the computer wavelengths that are giving you the headache. It can also be that accommodative focusing system that needs a little bit of stress relief. You know, the way God put us together, we were mostly distance, right? Farmers, hunter-gatherers, for centuries, right? And now we're on a computer all day. That focusing system is going to give you a little bit of a headache when you're on a computer for 6-8 hours a day, like some of us end up being. And so a little bit of plus, like a reading glass, like a really light reading glass in there, or a little bit of prism to help relieve some of that can actually be super helpful, even beyond just the blue light. And so there are things we can do to evaluate.
I know looking away, I assume, would also be helpful.
Yes. We have what's called our 20-20-20 rule. Every 20 minutes, take a break for 20 seconds, looking at least 20 feet away. Because we need those eye muscles to release and relax and open up so that we're not clenching and spasming up close. So yeah, looking up, looking away, get away from your desk. Right, set a timer.
Okay, that's helpful. And I thank you for saying that. I think that will be helpful for people listening here. Okay, I'm trying to think. Oh, and then I have a client who had a lot of trouble on the computer particularly with doing spreadsheets, like looking at the small, like trying to find a specific thing and then looking down at a piece of paper that he had and was trying to compare. Like, could you speak to that for a second? Is that an issue with just trying to adjust the eyes or the screen, or what kinds of things would be going on with that, do you think?
Yeah, there's a couple of things that are going on with that one. A task like that is going to involve your convergence, your combination, and your tracking. That is a Olympic sport for your eyes, right? So your tracking, computers don't have this nice left to right like a book does. And so you are constantly jumping from one thing to the next all over just by being on a computer. Then if you add something, notes in your lap, or the second thing that you're referencing, then you are adding in a convergence down, then diverge back up to the computer task. So converge, diverge, converge, diverge. You're also accommodating and focusing up close, and focusing a little farther away. And so you have this dynamic of up and down, back and forth, in and out. And that constant motion, in some ways, is good for your eyes because it keeps them a little more flexible. You're not just locked in on one thing. But if that's a part of the system that's been affected by a concussion, that's going to be really uncomfortable. I think one of the fastest ways for me to make my concussion patients sick is to grab a set of flippers that I have and then go from convergence to divergence, convergence to divergence. Yeah, you're shaking your head. It's like, they are like, I don't know what you just did, but my stomach is sick and I'm nauseous and I'm dizzy. They're just like this, right? But that converge diverge is going to affect your periphery. You're moving your eyes, and so there's a peripheral motion element to that as well. And so now you're adding motion and central and peripheral and different distances and accommodate. Yeah, so you're doing all of those tasks, and it's daunting for a post-concussion patient, and it's completely doable for all those patients who haven't had anything happen, right?
Yes. And I appreciate you saying that. I hope that anybody listening who has maybe felt off when they've been trying to do tasks at the computer feel justified after hearing that. Like, you're not crazy. This is real. And it is kind of crazy how much, like you said, like you just flip something in front of somebody's eyes a few times and like physiologically they have a response. Like you feel your stomach and nothing has changed. You haven't moved your body at all. It's just your visual perception. Like it's so interesting. Like,
yeah, and it really is just, it's so much, and it produces, as a secondary effect, you get cognitive problems and you get memory problems because you can't remember what they're doing. They don't feel like they can be confident in what they're looking at. And so you end up with stamina problems, and their whole body just starts feeling drained from doing just basic computer tasks. You would think it should be not taxing, right? But it's super taxing when you're doing as much as you are with your eyes.
Yes, and it's especially challenging because there are so many people whose jobs require them to be sitting at a computer.
Yes. Yep. And not just sitting, but then they also have to take an input from other coworkers who are coming by, or being on a phone while they're on a computer, and adding an auditory task to a visual task. And yeah, it just becomes a lot. And yeah, so too many people out there with desk jobs, and it's tough for them.
Do you have what other than the 20-20-20 rule, are there any other things, advice you would give to people who are in that situation, who are just like, I can't, this is too much right now?
Yeah, and people are probably going to do some of these things naturally already, but try and reduce how visually busy your workplace is. If you can get an office rather than like an open office where you've got lots of people walking around, it's going to be less visually stimulating for you. If you can knock out the fluorescent lights and find other lights to use, that's going to be better for you as well. And then better monitors. There are some monitors that are better for vision than others. So the newer ones can be good. If you get a really high definition monitor, that can be too much though, because you have this Amazon river of information going into your eyes. And now if you get a 4K monitor, you've just increased how much information is going through there. So high resolution without going 4K can be kind of a nice balance.
Okay. I've heard of flicker-free screens. What are your thoughts on those, or monitors?
Those are better. Yep, because if you have a flicker and a refresh rate that is just outside of what you are consciously able to perceive, then it's going to feel just like a fluorescent bulb, and it's going to be taxing for you.
Okay. Good to know. That's really helpful, I think. And another question, sorry. I knew that all these questions would be coming up as we're having this conversation. So we're definitely gonna have to pull you back in for our other topic, because
that's great.
Oh, so good. But I've heard people talk about a lot of times people, like you mentioned, your client who has a hat and sunglasses on. People want sunglasses to decrease the headaches and the light sensitivity. And I was told that the sunglasses will filter out, a broad spectrum of light. And so it would be better to do colored glasses, and not necessarily Syntonics, although that would probably be ideal if they are working with somebody who knows what they're talking about with this. But would you advise people who are listening to, if they're needing sunglasses, to maybe try just a colored glass instead of sunglasses, so that they're getting some more input into their eyes from other colors?
I don't, that's a tough question to answer actually, because some people may just need the whole system go down a couple of notches. And that the sunglasses act as what's called a neutral density filter. And so we're just calming all of it down. We like all of it, just not in big portions. And so a sunglass can be a good place to start. Polarized glasses can be a really good place to start as well, because then you're knocking out just the most obnoxious glare in your environment. But polarized glasses tend to be a less dark lens. So you're getting more information but knocking out the most obnoxious stuff. A couple of the colors that they can try, Aqua is good, FF41 are good. But outside of that, it's going to be a little bit harder to just find a lens that may be better for you. And I don't know that a colored lens would necessarily be better than just a sunglass pair in some cases. It would depend on the patient. And if they feel better in an Aqua, great. That's perfect. If they feel better in an FF41, that's great too. But we know people are going to feel better in a sunglass pair generally as a good starting spot. And they're just so easily available that that's great to have those. Sunglasses, you also just have to watch for the quality of the lens, because sunglasses can be so easy to get a hold of. Even without a prescription in the lenses, you can have distortions in the lens that would give you a headache. A better pair of sunglasses is going to be better for you in most cases. There is no great system like we have for diamonds, checking the clarity and the distortions and stuff. So they don't have them listed on the glasses, but really easily, like I can check here at the clinic 5 to 10 seconds, look at the quality of your sunglasses and see if they're going to give you a headache or not.
Interesting.
So there are ways to check the quality of glasses to make sure that they are the right pair for you as well. So don't get the cheapest pair of sunglasses out there. Go up a little bit, spend 20, 30 bucks or something, right? You know, get a better pair and you'll usually get better quality with better price.
Yeah. Okay. Excellent. That is so helpful and so fascinating. My mind has been enlightened today. So thank you so much for sharing all of this experience and knowledge and crazy stuff that I had no idea about. It's so fascinating.
You're so welcome.
And yes, if you're okay, we will love to like bring you out. The other topic is like, we could have another full conversation like this.
Yeah, we definitely can. Well, thank you for the invitation to come on. It's an honor to come on to your podcast.
Absolutely. We're so grateful. Thank you so much. Appreciate it. Any other final words, Kaylee or Dr. Duval, before we close here?
No, I guess the last thing is, if you on the podcast and you have concerns or questions, reach out to somebody, get some help. There are things that we can do for visual conditions that you thought were not touchable, that you've already been told by someone else that there's nothing we can do to fix this. Just because they didn't know how to fix it doesn't mean that there are things we can do to fix it. So reach out to somebody, get some help, because there are things available to you.
Excellent. Yeah. Thank you. And yes, we will put that, I know the locate a doctor thing on the COVD website, but also I understand that you can do virtual meetings with people as well if they want to work with you. Or I know I have a friend who's coming out to see you like from Illinois for a couple of weeks, so you can do intensives as well. So just people can work with you, right?
Yes, there are ways we can figure out how to work with you. You've got patients from your last time from your podcast, we worked with someone in New Hampshire and fixed them completely remotely. We've got patients who are in Australia and Sweden and all over, so we can help them as well.
Awesome. Yeah. Awesome. Well, thank you so much, Dr. Duval. Thanks, Kaylee, for being here and asking excellent questions. And we'll do this again.
Yeah, thanks, Kaylee. Thanks, Bethany.
I'm so glad you listened in today. I hope you have gained some helpful insights and inspiration regarding dealing with and recovering from concussions. My goal is to create more awareness and education about concussions and the fact that there is so much that can be done to improve life after someone has had one. Help me spread the message by liking, commenting, rating, and subscribing to this podcast, and share it with others who would benefit from hearing it. There are more resources available on my website. And again, if you or someone you love would benefit from concussion coaching, sign up for a free consultation using the link in the show notes or at my website, www.theconcussioncoach.com. Thank you. See you next time, and take good care of that amazing brain of yours.